And now to the monkeypox outbreak, from COVID to monkeypox, where the case count is climbing here in the U.S.
That's right. The CDC is working to make more vaccines available to high-risk adults, but parents are beginning to worry about the growing number of cases in children. More than 18,400 cases of monkeypox have been confirmed in the U.S., and as of August 21st, only 17 cases were confirmed in children younger than 16. But with kids heading back to school, some parents are concerned that number will grow.
And Dr. Susannah Hills joins us now for more on this. She is a pediatric airway surgeon at Columbia University Medical Center in New York City. Doctor, welcome. Thank you so much for being with us. Look, I'm a parent. I know that I'm a little concerned about this going back to school thing, only because I'm a parent of two boys, and I know how messy and unhygienic they can be. And I'm thinking about things like locker rooms and sweaty uniforms and playgrounds where kids are rolling over each other. How worried are you that back to school will result in more kids being infected with monkeypox?
Well, from my perspective, this disease, and from what we're seeing with the number of cases over the past number of weeks where we've had monkeypox in our environment, the rate of transmission is much lower than it is with something like COVID-19, for example. So the chance of getting this virus is significantly lower. We've only had so far 17 cases in children, but over 18,000 cases in the United States. So I don't think that there's likely to be a significant rash of cases among children. The main reason for that is that this virus is less easily transmitted. It requires close contact with an individual with the virus. Likely you need contact with the lesions themselves or the fluid in the lesions through skin-to-skin contact or fabric, clothes, towel to skin contact. Contact from environmental sources like doorknobs, tables, much, much less likely.
So, doctor, even if the risk is lower, are there some things that parents can do to help protect their kids from exposure?
Yeah, well, that is an excellent thing to talk about, Michael. Yes, there are some things you can do. The one thing I want parents to think most about is actually if their own child has a rash and they're not sure what it is, please go right away to your pediatrician to get a diagnosis and to figure out what it is, because the main protective measure is to isolate cases of monkeypox when they appear. So if your kid has a rash, please go to the doctor. It can look like hand, foot, and mouth disease. It can look like chickenpox. So go get it looked at and make sure that everybody is being protected. The other thing to talk about with your kids is just for them to do good things like hand washing, to be a little bit more careful with skin-to-skin contact with other people, to keep that in mind. But generally speaking, the things we do to control any kind of infection, things like hand washing, things like, if you're sick, staying home, if you're sick, wearing a mask, and if your kid has a rash, certainly seeing a doctor and covering the lesions so they're not exposed to the environment is very important too.
All good advice. I wish we could, be reassured that kids would follow it all the time. But, so Dr. Hills, I want to, right? That's not so easy. Dr. Hills, I want to pivot really quickly to COVID-19. As we were saying earlier, the FDA has authorized its first update to vaccines and booster doses, now specifically targeting the most common Omicron strain. How important do you think this step is in the overall fight against coronavirus?
Yeah. Well, Tanya, the vaccine itself is very helpful. It's a bivalent vaccine, like you guys were mentioning, in that it covers both the Omicron variant and the other strains that we've been exposed to. So the vaccine itself will be incredibly effective. The challenge is, though, getting people to get that booster to be protected. And we just have to remember that COVID is the third leading cause of death in the United States. But people are getting more and more used to it, more and more comfortable with it. So hopefully we see, especially people who are particularly vulnerable, people who are immunosuppressed, the elderly, hopefully they'll get right in line to get this updated booster. But it would be really helpful to see children who are eligible, those who are 12 and up for the Pfizer, those who are 18 and up for the Moderna, go and get this vaccine too, so that we can try to manage COVID spread in schools this year as well.
Especially as everyone heads back to schools. Dr. Susannah Hills, thank you so much for joining us.
Thank you.